1 ml of Juvederm Ultra Plus in my lips, and now they look so big. What can I do to bring it down? Hi doctors. I have done my lips yesterday afternoon. I used 1 ml of Juvederm Ultra Plus. The top of my lips are massive. I look like a duck face. I know they are swollen, and they still will go down. But what would happen if they don't? What can I do to take it away from the top?
Thank you for your question. You stated in your question you had 1 milliliter of Juvederm placed in your lips yesterday, and you feel like your upper lip looks very large. You describe it as yourself as looking like a duck, and you are concerned about the results and whether it could be undone. And I think, and you submitted some very good photos to help me understand what your situation is. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic surgeon, and we do a lot of fillers in our practice. I've been in practice in Manhattan and Long Island for over 20 years, and we use a lot of Juvederm, and certainly improving lip aesthetics is one of the most sought-after procedures we provide because of the importance it is to have nice-looking lips. So to begin with, let's just understand a little bit of the process, and I'll tell you what I do in my practice, and hopefully if this was comparable to what was done for you, you'll get a better sense of what to expect. So to begin with, I recognized for years that lips are very sensitive and they can swell very significantly. So when I do lip enhancement in my practice, I actually have the patient see what the lips look like immediately after the completion of the injection. So I do what I'll do. I'll place the injection, and my assistants are often there to share their opinion and give me some feedback as to what areas need augmentation and what areas can be left alone. And after I'm done with completing the procedure, I give the patient a mirror and I have them look at it. And the reason I do that is this is a small window before there is going to be two types of swelling. One is just reactive swelling. Think about it. It's like eyes. If you bump your lip, it swells tremendously. Then there's another part of swelling, which is the material. The material will absorb water, and a lot of times that's responsible for a certain percentage of the swelling. We routinely give the patients a little cold compress or a little ice to help minimize the swelling in their lips, particularly if they're going back to work. Now, lip aesthetics can be challenging. Now, this is going towards the question about the duckish appearance of your lips. Is that an aesthetic lip, whether it's the golden ratio, the 1.6 to 1 ratio between the lower lip and the upper lip, or the 1/3, 2/3 ratio for the upper lip and the lower lip. These are the ratios that are very, very important, and we see too many celebrities and too many people walking around Manhattan and Long Island looking like duck lips long after they had their injectables done. So I think that one thing to be mindful of, and I know you acknowledge that in your question, is that swelling is a big part of the response when people feel like their lips are exaggerated. So I always recommend that apply ice as much as you can tolerate for the first couple of hours if necessary, if the lips appear to swell. A lot of times people don't swell that much. It depends a lot on the individual. It depends on the amount of manipulation there was during the time of the procedure. 1 milliliter between the upper and lower lip is not a lot, but again, it just depends on how you respond. If this is your first time getting this filler and you have no experience like this before, then this might be what you have to anticipate in the future. I always tell a lot of our patients who come for the first time for injectables that if they have never had this type of injectable done, particularly in the lips, I always tell them, give yourself a day or so just in case you swell to a level where you would not want to be seen by other people. So maybe do it on a Friday and then allow yourself the weekend, because by the time Monday rolls around, typically it's down well enough. Now, if for any reason you still are not happy with the results, there is an enzyme that is used called hyaluronidase. And this is an enzyme that will dissolve the material, and it can be done. But I would say you should allow a little bit of time. In our practice, we have our patients come back after 2 weeks for any type of injectable we do, just to see how things look. Sometimes it's an opportunity to augment or enhance. An interesting thing with lips, and this goes back to the days before the injectables when we would use mainly fat as a filler for lips, is that the patients would be very scared in the first couple of weeks after, let's say, fat grafting procedure to the lips, and then 3 months later they'll ask if they can get more fat put in. And it's because of the reactive swelling, because the lips can really swell significantly. So once again, expect that swelling is responsible and that you should manage that in the first 24 to 48 hours. Contact your doctor. The doctor may want to put you on an anti-inflammatory if appropriate. And in addition, be mindful that it does often take 1 to 2 weeks for it to settle, so that you have a better sense of what it will look like in the long term. The long term being about the next 3 to 6 months, depending on your individual metabolism and how the material responds in your situation. That being said, I hope that was helpful. I wish you the best of luck. Thank you for your question.